Well, I'll go ahead and get started because I want to, I can't wait any longer to get going with this presentation. And then as people get in, they'll join us. But we'll go ahead and get started, everyone. Good afternoon. My name is Selena Barajas. I am the Arizona State Director with Mountain Mamas. Mountain Mamas is a national nonprofit. We are located in the states of Montana, Colorado, and we're here in Arizona. I'm located in Tucson, Arizona, and we've been here in the state for a year and a month or a year and a couple months. Last September was when we started here. And I'm really honored to be here in the presence of Dr. Ana Guzman and Unlimited Potential. Um, Unlimited Potential is actually based in Maricopa County, correct, in Phoenix area. So we just met today in a virtual platform. We haven't met in person, um, but I've been meeting with your colleague since I started this journey with Mountain Mamas with Dr. Emma Vera. Shout out to her because she has been a part of our clean energy healthcare professional group with Mountain Mamas. And, when I got to know her and meet her through this platform, I got to hear more and more about unlimited potential. And interestingly, I was out in Phoenix a couple weeks ago with Mountain Mamas. We met as a coalition and I went out and got some coffee because I love coffee. And I got to meet her in person for the first time at a local coffee shop. So I got to meet her um, for the first time, and she's the one that introduced me to you. So thank you for being here today and for hosting our Lunch and Learn. So, Dr. Emma, thank you for connecting us. Today's Lunch and Learn and our last Lunch and Learn of 2025 is hosted by Unlimited Potential. This presentation is called One Health. The One Health approach is linking human health, community well-being, and the environment. I want to read a little bit about Dr. Ana Guzman's background because it is very impressive. And just so you all here listening and watching could understand a little bit more of how your background plays into this concept. So, born and raised in La Ciudad de Mexico, so Mexico City, received your education from the university over there, UNAM. During your training, you discovered that the vital role of preventative care, particularly for chronic conditions like diabetes and heart disease, um, played a instrumental role in what you're doing today. So after moving to the United States, you saw firsthand the urgent need for disease prevention in underserved and underinsured communities, a calling that has guided you for over 20 years in your career. Your focus has been in public health, education, and community empowerment. And you have been doing your work here in the United States, in Arizona, since you moved here to the United States. So thank you for being here in the state of Arizona and providing all that care here to our state. And at Unlimited Potential, you lead disease self-management programs for trainers, community health workers, and patients. Your One Health approach emphasizes how individual health, community well-being, and the environment are interconnected and essential to building healthier futures. You also serve as an active member of the Diabetes and Community Health Workers Coalition. In your free time, you enjoy walking, exploring art, and sharing good meals with your family. Well, I'm excited to hear about your presentation and, our lunch and learn concepts. We were talking a little bit about that before we officially started this presentation. Our goal with Mountain Mamas was really to provide this platform for you all to enjoy during your lunch. These lunch and learn sessions to enjoy the opportunity to hear about, clean air, sorry, clean energy, but also how it intertwines with our public health and how that's all interconnected. So I'm really excited that this is bringing it all together today. So thank you, Dr. Guzman, and I'm looking forward to hearing your presentation.
Thank you, Selena, for this introduction. Thank you for inviting me and give me the opportunity to talk about One Health. Uh, One Health is gaining recognition in the United States and globally as an effective way to fight health issues. Um, at the human animal environment interface, including some zoonotic diseases. It's interesting to know about this because when I was doing my training in medical school, we always just look a person as a patient, as an also a biology entity, but we don't see all around how the disease and health are connected with where we live and the environment. So when I came over here and started learning about One Health, it got my interest. So as you know, as Selena said, I was born and raised in Mexico City. So I understand that my accent is a little heavy. So bear with me and let's talk more about One Health. So One Health has been defined in many ways. At its core, One Health foster a collaborative approach to issues that intersect human, animal, and environmental health. So, what is this? What we see? What is the real definition about One Health? What is that? So this is a definition that you see at the screen from the US government definition, and that was established 2017. And as you read over there, One Health is an approach that recognizes that the health of people is closely connected to the health of animals and our shared environment. One Health is not new, but it has become more important in recent years. And this is because many factors have changed interactions between people, animal, and plants in our environment. So we are going to talk about that. So each year, this is very interesting. Each year around the world, it is estimated that zoonosis is the diseases that are shared between people and animals, that is a zoonosis, cause 2.5 billion cases of sickness and 2.7 millions of deaths. So it's so interesting about that because I was more focused, or when you go to medical school, you are more focused to be reactive and just see the disease and don't think about this, or just check chronic diseases without the infectious diseases. So uh, the One Health concept evolved from early ideas like One Medicine and gained a lot of prominence with global health challenges like SARS and if you remember the avian influence. So that drove the integrated health strategies and policies to develop worldwide. Although the term One Health is fairly new, the concept has long been recognized both nationally and globally since the 1800s. Scientists have noted that the similarity in diseases processed among animals and humans. Um, but human and animal medicine were practiced separately until this century. See, they have veterinarians for one side and doctors or medicine from the other side. So um, even though that was long time ago, they have that idea of the one medicine. Lately, is being recognized that we need to work together to improve the health of the people. So as you see, humans population are growing and expanding into new geographic areas. As a result, more people live in really close contact with wild and domestic animals, both livestock and pets. Animals play an important role in our lives, whether for food, for livelihoods, for travel, for sport, for education or companionship. So close contact with animals and their environments provides more opportunities for disease to pass between an animal and people. I remember when I got pregnant, I used to have a cat, and they told me, no, no, you cannot have a cat because the cat has this problem, and you can pass this disease to your children or to your baby. So it's interesting all this that they are recognizing with what the recognizing more and more. Our Earth has experienced changes in climate and land use, such as deforestation and intensive farming practices. Also, with a lot of use of pesticides, um, and this disruption in the environmental conditions and habitats can provide new opportunities for disease to pass to animals. So the movement of people, animals, and animal products has increased from international travel and trade. As a result, diseases can spread quickly across borders and around the globe. I don't know if you have experienced any of these type of problems, but one of my cousins, he passed because he got this H1N1. There was the porcine disease. And it's interesting. Sometimes we don't realize that all this connection between the animals and where we live. So diseases often spread through complex pathways involving humans, animals, and ecosystems. So understanding these routes or these paths, it is very critical. So we can, if we know that and we recognize and we study that, we can prevent outbreaks and managing health risks effectively. So it's important to recognize that we are connected. We are not just one person on one society. We live in this world, and this world is an environment, is animals, different types of communities that we interact. So the expansion of human and animal populations and the change in climate and land use and increased international travel and trade provide opportunities for disease spread. Approximately 75% of recently emerging infectious diseases affecting humans are diseases of animal origin. See, 75% of infectious diseases in humans are diseases from animal origin. So human pathogens and zoonotic diseases are those that are spread between people and animals, like rabies. So these zoonotic diseases, which originate in animals and transmit to the humans, pose very significant global health challenges. An example, I told you rabies or Ebola or Lyme disease. So it's important to have an integrated surveillance and control for this animal disease and also how they affect us. So all these changes in the environment, the population growth, deforestation, mobilization of people from around the world, immigrants or trades, have changed and have led to the spread of existing or not or non-endemic or new zoonotic diseases. So every year, millions of people and animals around the world are affected by zoonotic diseases. However, animals can sometimes carry harmful germs that can spread to people and cause these problems. These diseases are caused by harmful germs like viruses, bacteria, parasites, and fungi. These germs can cause many different types of illnesses in people and animals, ranging from mild to serious illnesses or even death. Animals can sometimes appear healthy even when they are carrying germs that can make people sick, depending on the disease or the zoonotic disease. Zoonotic is the illness of the animal. Zoonotic diseases are very common both in the United States and around the world. So the scientists estimate that more than 6 out of every 10 known infectious diseases in people can be spread from animals, and 3 out of every 4 new emerging infectious diseases in people come from animals. And you see over there in the on the screen, you can see different examples of diseases that can from animals that can affect us as humans, like rabies, salmonella, the West Nile virus infection, the fever, anthrax, brucellosis, Lyme disease, the ringworm, Ebola. And of course, there are more that can make us sick. So, One Health, what are the common One Health issues? Okay, so One Health issues include the emerging and re-emerging and endemic zoonotic diseases. So neglected tropical diseases, vector-borne diseases, antimicrobial resistance, when we use and abuse the antimicrobial or antibiotics, we are creating all these resistance, food safety and food security, environmental contamination, climate change, and other health threats shared by people, animals, and the environment. As I told you, as an example, antimicrobial resistant germs can quickly spread through communities, the food supply, healthcare facilities, and the environment, the soil and the water, making it harder to treat certain infections in animals and people. One of the experience that I have is when my mother-in-law, she got sick and she went to a hospital, and unfortunately, because her immune system was weak, she got this very hospital infection. It was the bacterial difficile. And that is very frequent in hospitals because they use and abuse of antimicrobial medications. So all these can alter our nice ecosystem and can create these vector-borne diseases or zoonotic diseases. So now we are going to talk about the vector-borne diseases. Vector-borne diseases are on the rise with warmer temperatures. I don't know if you noticed that this summertime here in Arizona, we have a lot of mosquitoes. I think it was more of the normal. I know that mosquitoes live around us, but at this time, I think this past summer, we have a lot of mosquitoes around. Also, it was an increase of tick problems around us. Okay, now diseases in food animals. These can threaten supplies, livelihoods, and economies. I don't know if you remember about they recall a lot of eggs because they got contaminated with one disease from the chicken. I don't remember right now exactly, but we didn't have enough eggs because all the chicken were sick. Contamination of water. The water that we use for drinking or for recreation and more can make people and animals sick. I don't know if you know, have you ever heard about the amoeba? Amoeba, I don't know how to say that. That affects your brain when you go into a river that is contaminated. Even the fields of chronic disease, mental health, injury, occupational health, and non-communicable diseases can benefit from the One Health approach, involving the collaboration across the different disciplines and sectors. So I talk about this, the environmental factors such habitat destruction, climate change, and pollution impact the spread of diseases and health outcomes for humans and animals alike. So we need to have this holistic approach to health management so we can collaborate with different science, different professions to improve the health of the animals, the environment, and the people. So One Health finally is gaining recognition here in the United States and an effective way to fight health issues at the human-animal environment interface, including this zoonotic disease. The CDC used the One Health approach by involving experts in humans health, animal health, environmental health, and other relevant disciplines and sectors in monitoring and controlling public health. So the success of public health interventions require the cooperation of humans, animal, and environmental partners. Professions like doctors, nurses, public health practitioners, epidemiologists, veterinarians, agriculture workers, ecologists, wildlife experts, and other areas of expertise need to communicate, collaborate, and coordinate activities to prevent this type of diseases in our world. So by promoting collaboration across all sectors, the One Health approach can achieve the best health outcomes for people, animals, and plants in the shared environment. So it's important for us to really protect the biodiversity and to help in conservation. What else can help? Well, I don't want you to feel so anxious and depressed about the way that we're doing now. It's better to see the good and how One Health is helping to approach better health for all of us. And I have a nice story to share with you, a success story. So here in United States, in the southwestern, in the Mexican-US border, around here in Sonora, they have a lot of dogs, brown dogs, and these carry a lot of ticks. They carry ticks, and these ticks causes the Rocky Mountain spotted fever in people and dogs. So in Arizona, this side, and also in Sonora, the free roaming dogs were spreading these ticks out and people, and they got sick. People got sick, and some died from the Rocky Mountain spotted fever. So, public health and animal health officials use long lasting tick collars on dogs, regular pesticide application around homes, community education, and provide free spade and neuter for clinics for dogs. And after only 4 months, 99% of dogs were tick free in the community, and the number of people who had the Rocky Mountain spotted fever went down in the community. So, this is a success story about how collaborating between public health and also the community and the health officials and veterinarians work together to improve the health of one particular community. So that is a success story. So we can keep going and learning more and share more and collaborate to improve the health of the communities. But my question is why we need to know that? Why we need to know that One Health? Well, One Health is a very vital, integrated approach addressing these complex health challenges and to create the connections and humans, animals, and the environment. Embracing this framework effort offers a path toward healthier, more sustainable future worldwide. And also because it's gonna create this awareness on us and to be more conscious about where we live, how we have this relationship with animals, and be more aware about. So embracing One Health supports healthier, more sustainable future for our communities and for our children, our future citizens. So with this, I'm done. You have more questions, but I want to talk before that, you don't have questions, that I have another session that is really interesting about trees and human health. So I hope next year I got invited again in Mountain Mamas so I can talk to you about the relationship between trees and human health. Is really interesting because we don't talk, we don't think about the that trees have a relationship with our health. So maybe if next year, I got that invitation to talk about this, the urban greening, agroforestry, forest conservation, and reforestation. So thank you for your attention. You have questions, please write it in the chat, and I can answer in Spanish. I think it's easier for me. Thank you, Selena.
Thank you so much, Dr. Guzman, for this awesome presentation and just for being here and sharing. I learned so much. I was really excited because just when I heard of the concept, One Health, I was very intrigued with the title and then hearing about your bio and hearing and seeing the slides. It was very informative and very holistic. With Mountain Mamas, we do a lot of environmental advocacy, advocating for our water, for our air, and our public lands. And this really tied it in of what we're trying to do here in the state. I do have a question around renewable energy. Can you talk a little bit how this approach by adapting or by just implementing a more renewable energy would support the goals of um, One Health? Or do you have some
Oh,
examples, I guess, of more concrete, like tangible examples of how we could implement some of this work here in the state of Arizona?
Wow, we are the sunny state, so we can implement more solar plants, instead of using carbon or water. So we can use that. I mean, we have the sun. At least the sun is free. What is not free is of the systems. But I think those systems can help us to reduce the deforestation
Mm-hmm.
in our communities. I don't know if I answered the question.
Yeah, no, I mean, solar for sure. That is something, thinking about in the new year for 2026. I can't believe I'm even saying 2026. But thinking ahead here with Mountain Mamas, I've been really trying to figure out what our topics are going to be about. So if you are listening, get ready because we do have some ideas coming up. If you are watching, get ready to hear more around the ACC, the Arizona Corporation Commission. We are going to have a lot of our conversations focus on that. Our other conversations will be connected to, the TEP and APS rate hikes. We are going to be talking about that. Mm-hmm.
Some of the thing is plant a tree around your house
Mm-hmm.
because the shade is going to give you it's gonna cool have a cooler effect in your house, and you are going to reduce the use of power to cool your house. So
Yes.
plant a tree. Also, trees can gonna help you to better quality of air, you know.
Yes.
So plant a tree. I think it would be a wonderful idea that everybody has two or three trees around their houses to help with the use of energy,
Yes.
especially in summertime.
Well, and that was, when we hear the term even renewable energy, it's really dense and sometimes you can get lost in the terminology or the definition. It doesn't matter if it's English or in Spanish. Um, Sometimes it could be very dense. So the fact that you were able to present this to us and provide visuals was very helpful for me to understand. I tell people all the time, I'm a very visual learner. So I appreciated the diagrams, the arrows, the labels was very helpful to see because I think, again, going into this new year and us here with Mountain Mamas going into conversations around, like rate hikes, again, the ACC, connecting this big level, um, I don't want to say concept, but big level machine with our community and how planting a tree could break that down and connect, how our bills could possibly go down if you have more shade, if you plant this tree, and then your electricity bill could hopefully diminish with more shade, with more trees in the neighborhood, and make that connection. So this presentation was really helpful to hear. When we started these lunch and learns, I really tried to bring organizations and really tried to bring presenters that had different ranges of experience and just different levels of locations too in the state of engagement of working around clean energy. So we started with the Arizona Youth Climate Coalition, and we had that virtual presentation, Ojas, who presented on their climate action plan with the Tucson Unified School District. And then we went into Mom's Clean Air Force. Fabiola presented on the impact of our air. And we had Dr. Chris Lim present on the air quality as well. And we had Las Aguas, a grassroots organization here from the south side of Tucson, Robert Jaramillo and Eva Carrillo Dong present about the water contamination and the history and how that has brought a lot of illnesses to this neighborhood here in Tucson. And then here ending it with you and again showcasing this holistic view of how the animals, the plants, the air, and I really appreciated today's presentation.
Thank you. Everything is connected. Another thing that people maybe is not going to reduce energy, but is going to reduce the mosquitoes around is to clean your backyard and try not to have those um, water, the state water, no movement like you have tires or accumulation of water, they can bring a lot of mosquitoes around. So clean your backyard and your patios of accumulated water so we don't have more mosquitoes around.
Yeah.
Also, if you are registered to today's session, I will send you a handout so you have more information with the links of this presentation, the resources of the sources, and also some YouTubes talking about One Health. If you want to really go more deep into One Health knowledge.
Yes, so if you did register for today's presentation, we'll do a recap. Dr. Guzman and I will get together. We'll do a little recap. I'll go ahead and we'll condense this video for you so you could watch this on YouTube. You could refer back to it. You could share this video. Please sign up to both of our listservs to receive our newsletters and our information. And we'll stay in touch because I would love for you to return back to Mountain Mamas because you did bring up a good point. We have a huge population here in the state of Arizona, not just here in southern Arizona, predominantly, Spanish speaking families, moms, community members that I feel like we need to really do some intentional outreach around, clean energy, around um, public health care, around our public lands, So I would love to bring you back in 2026 and see if we could do this presentation or something similar, especially around the trees. I love that. And I look forward to continuing on this conversation with you over lunch, maybe in person one day, and we could actually share a meal together. And if not, virtually can work too. We do live in this era where virtual is nice because we get to see each other and we could reduce that carbon footprint virtually, But no, thank you all for joining us today that you for those that did zoom in or if those that are going to watch here on YouTube. But again, please support and follow Unlimited Potential based out of Phoenix and all their good work. Follow their social media. I see all the wonderful work you all are doing from the yoga sessions to the workshops and yeah, a lot of intentional work with, Spanish speaking community to elders in the community. So thank you for the work that you all are doing in Maricopa County and here with Mountain Mamas. Please follow our journey. Please sign up to receive our monthly newsletter because that is how you find out about our Lunch and Learns. That is how we'll be able to upload the one pager that or the handout that Dr. Guzman was sharing. I'll make sure to include that in our newsletter, and you could stay in the loop for our future Lunch and Learns for 2026. Would you like to say anything before we close out?
Well, I just want to say thank you, Selena, for inviting me and the opportunity to talk with your community about this important topic. Thank you.